So today we will do this small chapter of vitamin-like substances. Those who have the textbook, it's on page number 411 in your nutrition science textbook, 411. If anyone is joining late, please help them out with the page number or the chapter number. It's chapter 22, page 411. So we'll start the session. The vitamin-like substances, actually, they are neither vitamins nor minerals per se, but they have a lot of their characteristics are quite similar to how vitamins function in your body. Okay, how vitamins interact with other substances in your body. These substances also interact in the same manner. So that's the reason why we call them as vitamin-like substances. But actually, if structurally you see them, they're neither vitamins, okay, neither minerals, but they act more or less similar to vitamins. Okay. So the first vitamin-like substance is choline. So it's a vital nutrient, which means your body makes it in very small amount. Okay, your liver is able to make it, but in very less amount. So you require the choline supply from diet. Okay. And what happens is many cases that people they don't realize that they are choline deficient, and when their consumption levels falls quite low, that's when they catch the choline deficiency. Okay, but majority of the choline sources are non-vegetarian sources. Okay, beef, chicken liver, salmon, eggs. Okay, these are the richest sources of choline. And it was also recently discovered in the late 90s. It was discovered that choline, it acts as a vitamin-like substance. So you need to get choline from your diet to avoid a deficiency. And your body can make it. Your liver is able to make choline in very small amounts, but majority of it you have to get it from your diet. Okay, and it is organic. It's water soluble, neither a vitamin nor a mineral. Usually we group it with vitamin B complexes because the way how choline functions in your body is very similar to B complex vitamins. Whole grains and cereals also have a certain degree of choline, but not as good as or not as best as the non-vegetarian sources. Okay, whole grains and cereals, they also have certain degree of choline, but not if you can't compare it with the non-vegetarian sources. Okay. So the major functions of choline in your body, cell structure, it is needed to make the fats that support the structural integrity of the cell membranes. Okay, to make that fat, you require choline. Choline helps in making specific fats. Okay, your cell membrane is also made up of your structure of the cell membrane is fat dependent. Okay, so for that structural integrity, choline is required. And the transportation of compounds, okay, they will act as cell messengers. Choline will act as cell messenger. They are involved in the production of compounds that help in sending messages like nervous system. Okay, then fat transport and fat metabolism. For that also choline is important. It is essential for making the substances required for removing cholesterol from your liver. So for your for your lower cholesterol levels in the system, for your healthy liver, healthy blood vessels, choline is required. DNA synthesis also, choline and other vitamins such as B12, folate, they help in the process that is important of making of DNA. Okay. And for a healthy nervous system in general, choline is required. For example, acetylcholine, to make acetylcholine, definitely choline is a part of it, part of this chemical structure. And it's a very important neurotransmitter. Okay. not acetyl coenzyme A, it's acetylcholine. It's a neurotransmitter, helps in memory, muscle movement, regulating your heartbeat and other functions. Okay, so these are the main functions of choline within a human body. So daily recommendations for men and women, it's 550 mg for men, 425 mg for women. But if it is a pregnant woman, if it is a pregnant woman will require approximately 1000 mg of choline. Okay, pregnant women will require approximately 1000 mg of choline. Breastfeeding women can their RDA is equivalent to a man's RDA. 550 mg is enough for a breastfeeding woman. But if it is a pregnant woman, she may require 930 mg, approximately 1000 mg of choline on a daily basis. So good sources: eggs, meat, seafood. Okay. Strict vegetarians, those who do not consume even milk or eggs, like vegans, okay, they may have inadequate choline intake. So they may have to depend on supplements, dietary supplements as well. So that's about choline deficiency. If you have choline deficiency, there is an association of choline deficiency and fatty liver. The reason being, the presence of choline helps to take out cholesterol from the liver. Okay, the presence of choline, that's one of the main function of choline, to take out cholesterol and bad fats out of liver. Okay, so in the absence of choline, bad fats, cholesterol may accumulate in your liver and lead to fatty liver. Is it clear to all regarding choline? Only this much you have to learn about this, what it is. Okay, what are the main function of it, what are the major deficiencies you will get, major good sources, RDA. Okay, is it clear to all? Okay, next is carnitine. So it's an amino acid. Okay, amino acid, it's a kind of protein. Okay, identified in 1950s. And the role of carnitine in human metabolism was found out later, much later, 1970s. Okay, and it is a long chain fatty acid. It was linked to long chain fatty acid oxidation. So carnitine supplements, you must have heard about it regarding weight loss. Okay, L-carnitine, specifically L-carnitine supplements. Okay, they are marketed targeting people who are aiming for weight loss, saying that it is a fat burner. Okay, but nowadays we whatever recent researches are coming up is that L-carnitine supplements will not help you much with your fat metabolism. Okay, L-carnitine has an impact in fat burning, but taking this metabolism to speed up your weight loss, it doesn't work that way. Okay, just by taking L-carnitine supplements, you think that you can lose a lot of weight, burn a lot of fat. It does not work like that. Okay, so sufficient carnitine is critical in fat metabolism. It breaks down, it helps in the breakdown of fats because it is essential to transport long chain fatty acid from cell cytoplasm to mitochondria. Once the fats are into the mitochondria, mitochondria will burn that up for energy. Okay, so that's how the fat metabolism happens. Okay, so L-carnitine will help to pull the long chain fatty acids into the cytoplasm, into the mitochondria, where mitochondria will use this fatty acids to produce to yeah for to produce energy. Okay, so what is L-carnitine and what does it do? It's an amino acid. It is also made in your own body. Okay, including it helps in weight loss, helps in improved brain function. Okay, it's a naturally occurring amino acid. And it is very popular. It's a very popular supplement among those who go to gym or those who are looking for weight loss. Okay. It helps in the production of energy by breakdown of fat. Your body can also produce L-carnitine out of the amino acids called lysine and methionine. Out of these amino acids, your body can produce its own L-carnitine. Which means if your body can produce it, it is not an essential amino acid. Okay. But for your body to produce it, L-carnitine, there is one condition: you will require plenty of vitamin C to produce this. And also eating small amount of animal products like meat or dairy. Okay, you can get sufficient amount of L-carnitine through your diet as well. Vegans or people with certain genetic issues are not able to produce L-carnitine. So for them, supplementation will help. And there are L-carnitine is just one type of carnitine. There are other types of carnitine as well. D-carnitine, acetyl L-carnitine. Okay, there are different forms of carnitine. The main role of carnitine in your body is to make sure that mitochondria is functioning by breakdown of fatty acid and producing energy. Okay, so it helps transport fatty acids into mitochondria where it can be burnt for energy. And more than 95% of the L-carnitine within your own body, L-carnitine stores, are in your muscles. Okay, some amount of it is present in your blood, in your liver, heart, and kidneys, but majority of it is in your muscles. They also help in maintaining a healthy aging process. Okay, they will they will not speed up the aging. Having a sufficient amount of L-carnitine, you will look a lot younger for a pretty long time. Many studies are have claimed that some studies who want to market L-carnitine, they have claimed that L-carnitine supplements significantly reduce the body weight. Okay, but it has no effect on belly fat or body fat percentage. So those who are looking specifically for reducing their belly fat or reduce their body fat percentage overall, L-carnitine has no effect on it. Okay, reducing the body weight through energy only if you have sources to spend energy. Okay, if you just take L-carnitine tablets and not do anything and are not physically active, in which way your calories are burnt up, L-carnitine supplements will not work in that situation. If you're regularly going to gym or you're working out, okay, spending 1 to 2 hours in running, cycling, or whatever kind of physical activities you're involved in, and on top of it, you're taking L-carnitine tablets, yeah, there will be a significant reduction in your weight, but not your belly fat or your body fat percentage will have a brand names of L-carnitine supplements I'm not aware of. You can search online. Okay. There are different types of carnitine. L-carnitine is one type of it. D-carnitine, acetyl L-carnitine. There are different types of it. Okay. And it also helps in the growth of lean muscles. It supports the healthy environment for the growth of lean muscles, and which gives you a very lean and a defined physique. Hardly 1.3 kg or 2 kg weight loss can be achieved with the help of L-carnitine supplements, not more than that. Okay. Food sources, best food sources of carnitine. Majority of your non-vegetarian food: beef, pork, chicken, fish, milk. Okay. For vegetarians, it's better you take L-carnitine supplements. And always remember, the darker the color of the flesh, okay, whatever meat or whatever non-vegetarian product you're using, the darker the color of the flesh, more is the amount of carnitine in it. Okay, the presence of carnitine makes the flesh color darker, whatever meat you are having. So white poultry meat, like broiler chicken and all, they will have very less amount of carnitine as compared to dark poultry, red meat. Is it clear to all about carnitine functions, how it functions in your body, who requires it, best sources? Next is coenzyme Q10. So coenzyme Q10 is a molecule used by human body during aerobic cellular respiration. So Q10 does much of its work in the mitochondria. Mitochondria is a place where the cell where energy is produced, and coenzyme Q10 is also an antioxidant. It has different names as well. Okay. Here we call it coenzyme Q10, but it has different names as well. So it is the most fat soluble antioxidant. So it protects the areas with fats like linings of the blood vessels against oxidative damage, which means the blood vessels that you see, okay, inside the blood vessel lumen, okay, it's inside part of the blood vessels, there is a fat lining, okay, and these fat cells can also undergo oxidative damage. If the blood vessels lining undergoes oxidative damage, it is very easy for the blood vessels to catch up with cholesterol atherosclerosis. Okay. So coenzyme Q10, majority, for example, if I take vitamin C as an antioxidant, vitamin C is a water soluble antioxidant. Okay. So coenzyme Q10 is a fat soluble antioxidant. It can be stored. This is the type of antioxidant which can be stored in your body. Okay. So, and it protects the inside lining of fat lining of the blood vessels. So it will protect your blood vessels health, elasticity, and its health for a longer run. Okay. Having adequate amount of coenzyme Q10 within your body, it will ensure that you do not suffer from vascular damages or vascular diseases. Okay. So it also helps supports the skin health, brain, lung health as well. Okay, chronic diseases like cancer, diabetes. More research is required to understand the actual benefits of coenzyme Q10, but there are few facts which we already know. So genetic defects in coenzyme Q10 synthesis can lead to low levels of coenzyme Q10 deficiency. Any mitochondrial diseases, aging. With aging, the utilization of coenzyme Q10 falls down. If you are on statin treatment, this is for people who suffer from hypertension. Okay, those who are having high blood pressure, you will be put on statin tablets. Okay, statin is a group of medication given to treat blood pressure. Okay, so if you are on statin tablets, that will negatively affect coenzyme Q10. It will not allow coenzyme Q10 to function properly. And to an extent, it may help treat heart failure as well. Like the oxidative stress that your blood vessels suffer from, coronary vessels suffer from. Coenzyme Q10 can protect the blood vessels from oxidative stress. It could help with fertility, which is not sure. We are not sure about it, but it could help with fertility. Even in men, the male sperm is susceptible to oxidative damage. So with adequate amount of coenzyme Q10, the male sperm will not undergo oxidative damage. Poor sperm quality, these kind of situations can be reduced sperm count. This can be avoided. Supplementation of coenzyme Q10 can help in reversing the aging of egg quality. Okay. After the age of 30s, okay, after 30, like once a woman crosses the age of 30, the egg quality diminishes. Okay, if she is still fertile, the woman will still be fertile, but the quality of the eggs, okay, the best quality of eggs are they happen in your early 20s, mid 20s. Okay, after that, when you approach your 30s, the egg quality in females falls down. Okay, egg quality falls down means you will be your ovum is producing eggs. Okay, but they are not good enough for fertilization. Okay, it could lead to miscarriages. Okay, other issues, fertilization issues, fertility issues. Okay, the quality of the egg falls down after the age of 30. Okay, so having coenzyme Q10 supplements can reverse this egg, um, the aging of the egg quality. Okay, the egg quality can become better with coenzyme Q10 supplementation in women. So this is how it can help with fertility. More researches has to be done here in this case. For cosmetic purposes, it can help in supporting in healthy skin aging. It can prevent wrinkle formation for a longer time. Since it's an antioxidant, it is supposed to do that. Even for migraine in children, the frequency of migraine in children and adults have reduced after they are put on coenzyme Q10 supplementation. So it helps, it aids in migraine. It will not prevent migraine, but the frequency of migraine can come down. So these are the good sources of coenzyme Q10. Pasture-raised meats, organ meats like heart, liver, kidney, other just source, wild caught fish, pasteurized egg yolk. Pasteurized means the ones you, not the cattles or the poultry that you prepare at an industrial level. Okay. Here, pasteurized means you allow the chicken to roam around in the fields, okay, to eat on wild things. That is pasteurized. And even the pasteurized meats, cattle are allowed to roam around, be active. Okay, these kind of cattle meats are pasture raised meats. Grass fed butter. Okay, the cattle which is grass fed, not fed on any specific diet, grass fed cattle, the butter that comes from the dairy of such cattle. And all the non-animal sources have lower amounts, even though there are vegan sources, but you cannot compare the like 100 gram of what an animal sources can give you of coenzyme gluten is not at all equivalent of to what 100 grams of vegetarian sources or vegan sources can give. Okay, so avocados, olive oil, olives, broccoli, cauliflower, sweet potato, all forms of nuts, walnuts, sesame seeds, hazelnuts, these also have coenzyme gluten to a very less degree, not that high. Is it clear about coenzyme Q10? The only takeaway is it's good for heart health. Okay. If you run a risk of cardiovascular diseases in your family, it's better you focus more on coenzyme Q10 based diet or supplementation. Okay. Next is lipoic acid. So it's known as an organosulfur compound. It has sulfur molecule in its chemical structure, and it is extremely important cofactor for many enzyme complexes within your body. It will assist in a lot of anti-inflammatory response within the body, plays a major role in energy pathways. It is both fat and water soluble, lipoic acid. And it is also called as a universal antioxidant because it is both fat and water soluble. Alpha lipoic acid, etc., is like it's associated with weight loss, diabetes management as well. Supports in weight loss. It does not leads to weight loss. It supports in weight loss. And even the body, our human body naturally produces alpha lipoic acid, but it is also found in a variety of foods and as a dietary supplement also you can buy it. More research has to be done on alpha lipoic acid, but so far that we know that it also causes changes in the energy pathway within the mitochondria. It can help turn it helps in the formation of enzymes that turn nutrient into energy. It does not directly turn nutrients into energy like fat or glucose. It will not directly turn them into energy, but it helps in the production of enzymes that can help turn these nutrients into energy within the mitochondria. And it is both water soluble, fat soluble. So so because of this nature, it can work in every cell and or every tissue within your body. For example, like as I mentioned earlier, vitamin C, it is only water soluble, but vitamin E is only fat soluble. Okay, so they work differently within your body. They can lower your blood sugar levels as well. So yeah, in a way, it can mimic insulin, reduce inflammation. Again, it can slow your skin aging because it's an antioxidant. It can improve your nerve function as well. Again, majority of the sources of lipoic acid, red meat, all the organ meats are great sources. Plant-based food like broccoli, tomatoes, spinach, Brussels sprouts. Okay, they also contain alpha lipoic acid. But if you take supplements of alpha lipoic acid, it can give you more than 1,000 times of alpha lipoic acid than what a food source can give you. That's the only benefit of taking supplements. The way how it aids in weight loss is it will suppress the AMPK. AMPK is a hormone, it's an enzyme that uh, helps with the increased feeling of hunger. Okay, so alpha lipoic acid will suppress the AMPK enzyme. Okay, it's an activated protein kinase enzyme, something like that is the name of AMPK. So AMPK enzyme will increase the tendency of hunger within humans. So what alpha lipoic acid does is it will suppress this enzyme. Okay, so you will not feel much, like you will not feel the frequency of hunger will reduce, and that leads to weight loss. And it will only slightly impact weight loss. It will not give a major impact in weight loss. And even in animal tests that were done, even in that it was shown that alpha lipoic acid was able to reduce the blood glucose level. I have mentioned the enzyme in the chat box. You can Google the entire name. It is a AMPK activated protein kinase enzyme, something like that. And also not just lower the blood glucose level, but it can also reduce the insulin resistance. It can also lower the fasting blood glucose levels, even HbA1c levels, that is the glucose in hemoglobin. Okay, these levels can also undergo reduction with proper alpha lipoic acid supplements. Even it helps in brain health, specifically memory health. Alzheimer's disease, those who have the family history of Alzheimer's disease or dementia, With alpha lipoic acid, loss of memory can be prevented. And we have a very few studies supporting this statement, but alpha lipoic acid does improve the memory. It promotes in healthy nerve function as well. Reduces it has an anti-inflammatory effect, so it reduces inflammation associated with diabetes, cancer, obesity-related diseases. Foods that contain lipoic acid, kidneys, liver, kidneys, heart, these are organ meats. Broccoli, spinach, sprouts, Brussels sprouts, peas, tomatoes. Okay, these are the vegetarian sources that contain lipoic acid. Is it clear to all? We are reaching the last topics of vitamin-like substances. It's a very small chapter. Next is inositol. It's also known as vitamin B8, even though it is not a vitamin at all. But again, it also, just like choline acts like a vitamin B complex. Inositol also acts like a vitamin B complex. Okay, very similar in characteristics and all. But it is more like a sugar than a vitamin B complex. It influences the action of insulin and also may aid in mental health and metabolic conditions, including diabetes, insulin resistance. It naturally occurs in foods like fruits, beans, grains, nuts. Even your body can produce inositol from carbohydrates that you eat, from glucose that you eat. But even if the body is producing inositol, on top of it, if you're taking additional supplements, it can give you more health benefits. And again, it plays a structural role in your body. It's a major component of your cell membrane. It influences the action of insulin, controls the blood glucose level, and it also contributes in the formation of chemical messengers like serotonin and dopamine. So serotonin and dopamine are like antidepressive. Okay, they keep you happy, they keep you energetic. The absence of serotonin and dopamine will lead to depression, other mental health disorders. Fruits like cantaloupe, that is muskmelon, okay, oranges, uh, brown rice, liver, green leafy vegetables, okay, they all have inositol in small quantities. And recommendation, actually, we don't have any specific recommendation for inositol, but it is said that 300 to 1000 mg on a day should be more than enough for adults. Even 18 grams per day, okay, not mg, 18 grams per day has much promising results with very few side effects. So you can go above 1000 mg. 1000 mg is 1 gram, okay? You can go up to 18 gram. So in mental health, it inositol is known to help balance important chemicals in your brain, specifically dopamine and serotonin, which affects your mood. People who have depression, anxiety, compulsive disorders, okay, they naturally have lower levels of inositol in their brain. So when they take inositol supplements, their mood uplifts. More research has to be done in this, but so far this is a relation that we could find. Okay, so there is some positive impact of inositol in mental health. Even in panic disorders, inositol supplements may be helpful for treating panic disorders and it's a very severe form of anxiety, panic disorder. Anxiety also has different types. In panic disorders, suddenly you may get rapid heartbeat, shortness of breath, dizziness, sweating. Studies are being conducted as of now. Studies are being conducted on people who have panic disorder with specific gram of inositol. More studies are yet to be yet to come out with a positive conclusion, but so far there is a positive effect of inositol on mental health. Even in depression, no, we do not have enough evidence yet, but there are improved symptoms. Those who were in the studies, those people who were in the studies with inositol supplementation session, there was improvement in their symptoms of depression. Even bipolar disorder, when it comes to reproductive health of women, polycystic ovarian syndrome, okay, it's a difficult disorder. There is no cure for PCOS. Okay, there is no cure. You will have to work with the symptoms. You have to elevate the symptom. Symptomatic management can be done. Usually, PCOS will lead to hormonal imbalances. Okay, irregular periods, infertility, weight gain, high blood glucose sugar levels. Okay, undesirable cholesterol levels, high triglyceride levels. These are what happens with PCOS in women. So, inositol supplements can improve the symptoms of PCOS. Inositol will never cure PCOS, but all these symptoms that I have mentioned right now, this can be elevated. Okay. Also, the way how insulin resistance happens in women who suffer from PCOS, insulin resistance can be treated with inositol supplements. A combination of inositol and folic acid can promote ovulation in women who suffer from fertility issues, women who are suffering from fertility issues. A combination of folic acid supplement along with inositol can improve your ovulation and can promote ovulation. 4 grams of inositol and 400 micrograms of folic acid is what they have used in this study. And also some metabolic syndrome diseases like too much fat in the belly fat area, high levels of triglycerides in the blood, high blood pressure, high blood glucose levels. These are metabolic conditions. Okay, these can also be improved with inositol supplements. And if you have a history, if your mother's, grandmothers, or anyone, any female in your family had a history of diabetes during pregnancy, gestational diabetes, that can be prevented with inositol. Okay, it can be. We are not sure of it, but there is some positive relation between prevention of gestational diabetes and inositol supplementation. That too, in animal studies, they have shown these results. But we only have a very limited number of studies that can support this statement. More research has to be done. So inositol, how it helps in reducing the blood cholesterol levels. It can break down the fats, specifically the LDL fats that are dangerous. It could lead to cholesterol. Those can be broken down, and it can be carried through in the circulation without getting accumulated in one place. So that's about inositol. Is it clear to all? They have not mentioned much about inositol in the textbook, but this is just additional information for you. Inositol sources I have shown you here. Supplementation is the best source, but apart from that, it's found in a lot of fruits, like fruits and animal food as well. Cantaloupe, that is muskmelon, oranges, brown rice, green leafy vegetables, organ meat. Okay, they all have inositol to a very small but in a very small quantity. But supplementation, specifically when you're dealing with PCOS or mental health disorders, heart issues, brain issues, okay, it's better to go with supplementation. Yes, a doctor's prescription is required, because the way how, if you are taking allopathic medications for treating these conditions, the way how inositol is going to interact